In transcatheter aortic valve replacement, clinicians may encounter severe symptomatic aortic stenosis, characterized by extensive leaflet calcification. When standard tools fail to achieve adequate valve area expansion, cardiac output remains limited and the risk of heart failure increases. Severe aortic stenosis predominantly affects aging populations and restricts forward blood flow from the left ventricle to the systemic circulation, significantly increasing ventricular afterload and impairing overall cardiac performance. This condition is driven by progressive leaflet calcification, which increases tissue stiffness and radial resistance at the annulus. These mechanical changes reduce annular compliance and can result in valve underexpansion, persistent transvalvular pressure gradients, and suboptimal hemodynamic outcomes despite intervention. The Edwards SAPIEN 3 Ultra Resilia transcatheter heart valve is designed for TAVR procedures to address these challenges and restore effective aortic valve function. The device features a high-strength cobalt-chromium frame, Resilia-treated bovine pericardial leaflets, and an integrated external sealing skirt to support secure anchoring and optimized flow restoration. The valve functions through controlled balloon expansion, applying radial force to anchor the prosthesis against the calcified native leaflets. This mechanism increases the effective orifice area to approximately 1.5 to 2.0 square centimeters, while the sealing skirt minimizes paravalvular leak, supporting stable and efficient hemodynamics. The cobalt-chromium frame provides structural integrity across multiple valve sizes, while Resilia-treated leaflets enhance resistance to calcification and support long-term durability. Safety features include a single-use, sterile delivery system that is fully fluoroscopy compatible, allowing for precise positioning and controlled deployment. A typical procedural workflow includes transfemoral vascular access, valve positioning across the native annulus, and controlled balloon deployment. Hemodynamic performance and valve positioning are confirmed using imaging before device withdrawal in accordance with the instructions for use. In contemporary TAVR registries, the SAPIEN 3 platform has been evaluated for survival and hemodynamic performance. Results demonstrate procedural success rates exceeding 95%, along with significant improvements in NYHA functional class in the majority of treated patients. Supporting data and endpoints are provided in the on-screen citation. Potential risks associated with TAVR include paravalvular leak, annular injury, and vascular complications. These risks are mitigated through sealing skirt design, imaging-guided placement, and strict adherence to IFU-defined procedural parameters. By addressing calcification-driven radial resistance with controlled expansion and durable valve design, the SAPIEN 3 Ultra Resilia transcatheter heart valve supports restored aortic valve hemodynamics and improved long-term clinical outcomes in appropriately selected patients.